Today's webinar will provide an overview of statewide efforts around addressing the dangers of lead air pollution. Max Weintraub is the chief of the Childhood Lead Poisoning Prevention Branch's Lead Hazard Reduction section. At the end of the presentation, Max will be available for questions, and a recording of this presentation will be available on our website, which is listed on the right hand of the screen. And a link to our website will also be posted in the chat for you. And with that, I will hand it over to Max to begin the presentation. Thank you.
Thank you very much, Jessica. I greatly appreciate it. I'm thrilled to be with you all this afternoon. This is a wonderful opportunity for us to discuss both the Childhood Lead Poisoning Prevention Branch's strategic plan, as well as our efforts related to primary prevention, and as an example of that, our work around leaded avgas. I will also, at the end of the talk, be discussing a bit about the future of our efforts as well. Next slide, please. The Childhood Lead Poisoning Prevention Program is made up of the California Department of Public Health's Childhood Lead Poisoning Prevention Branch and local public health agencies contracted across the state. The branch provides direct services in 19 uncontracted counties, and local health agencies are contracted to provide support in 42 cities and counties across the state. The Childhood Lead Poisoning Prevention Program accomplishes its mission and goals through community education and outreach, programs that provide education and outreach to healthcare providers, lead hazard reduction that reduces lead exposure, childhood exposures to environmental lead hazards, and case management services. Next slide. I'd like to give a quick overview of the program, and by discussing that the State Childhood Lead Poisoning Prevention Branch administers the program by also providing evaluation and research for surveillance and blood lead data analysis, as well as managing clinical laboratory electronic blood lead reporting. It also oversees program administration and fiscal functions. Next slide, please. I will briefly review the background on the strategic plan development. To help improve the focus of the program, strategic planning was needed to establish directions for the program and ensure our goals, objectives, and actions are meeting the program's mission and establishing long-term plans to meet the program vision. To ensure the program is moving on the right direction, we conducted a strategic analysis of program performance to determine the effectiveness of the current plan and process. The strategic planning process included review of the most recent public health literature and other states' lead program strategic plans, as well as informational interviews with public health programs, statewide housing coalitions, and other local childhood lead poisoning prevention programs within other states. The research informed both the direction as well as the objectives and actions that were incorporated into the final strategic plan. The strategic plan is using action-driven approach that will serve as a program roadmap with action driving the approach to integrate our priorities and daily activities. The purpose of this actionable plan is to deliver a robust case management process, enhance collaboration with community-based organizations, advance public health interventions through data-driven research, and as I will emphasize today, promote primary prevention, focused on the elimination of lead hazards before a child is poisoned. Next slide, please. The strategic planning process included review of the most recent public health literature. However, a key piece of it is that oh my goodness gracious. I'm sorry, I jumped ahead in my notes. So next slide, please. All right. There are 6 strategic areas of the program that goals are realigned to be more specific, measurable, and attainable in order to achieve the program mission. These are intended to be closely aligned with our existing program mission and vision. Our program has identified certain areas of focus that are prioritized in the strategic plan. Most of the priorities are existing program activities that we seek to strengthen. Priorities identified under this goal include Goal 1, program support. The Childhood Lead Poisoning Prevention branch embeds equity into program objectives, which you can find delineated throughout the strategic plan. We've designed strategies which prioritize learning from and working with communities, families, partners, and program staff to create the most equitable outcomes to address health disparities and eliminate lead poisoning. Our first goal for the program is to establish and support a successfully administered and equity-centered childhood lead poisoning prevention program in every local health jurisdiction. While developing and designing objectives under this goal, we prioritize adequate onboarding and regular training and more thorough technical assistance after each biannual reporting period and after each contract review. Goal 2, partnerships. We recognize that these result from effective outreach and education, and that they're most impactful when pursued in partnership with other relevant stakeholders. And so throughout the strategic plan, we prioritize collaboration and engagement with organizations that we have shared goals with. Although we recognize that collaboration partnerships will take place naturally throughout other goals and objectives, we found that by developing a goal which takes a multi-level transdisciplinary approach and implements strategies that are informed by family and community needs, we're additionally creating an environment that fosters trust and transparency and works towards achieving health equity. The Childhood Lead Poisoning Prevention Program, successfully working with the Department of Social Services and child care centers to prevent childhood lead poisoning prevention, is an example of one such partnership. Goal 3, lead-safe environments. That is our main topic today, and I'm going to come back to Goal 3 in the next slide. Goal 4, data-driven research. Such research seeks to leverage enhanced surveillance systems to allow the program to make informed decisions to and eliminate health disparities. These efforts will identify areas for program improvement, as well as identify public health best practices to better realize the program's goals. To effectively communicate findings and best practices, Goal 4 also focuses on researching and developing best practices around effective communication and feedback mechanisms, which the program will incorporate for future communication. The Childhood Lead Poisoning Prevention branch is providing resources for our local program partners on these topics, and we've been actively working on data sharing to help in addressing questions. For example, one area of research focuses on targeting identification and testing of children in high-risk areas in order to be able to serve all children who are lead burdened. Goal 5, blood lead testing. To respond to this priority area, this goal aims to timely detect all children who are lead poisoned through universal evaluation and risk-appropriate blood lead screening. To accomplish this task, we've designed objectives which highlight the importance of improving collaboration with medical personnel and community partners to work toward developing and improving efficient and effective assessment tools for both clinical and non-clinical settings. And Goal 6, robust case management of children identified as basic cases, potential state cases, and state cases of childhood lead exposure. Such case management is centered around providing integrated, child-centered case management and environmental services. Traditionally, one of our program's strengths has been providing high-quality clinical services to children identified with lead exposure to ensure treatment, follow-up testing, and identification and removal of sources of exposure in children's environments. We are continuing to prioritize this area and will seek to adopt an even more child-centered approach to meet the unique needs of the children and families we serve. One component of these enhanced protocols will be to develop robust referral systems to ensure family opportunity to receive recommended referral services. Next slide, please. Goal 3, lead-safe environments. Allow me to return to the Goal 3 strategic plan area of focus, lead-safe environments. It's the main focus of our talk today, how to prevent children from being exposed to lead. This goal is centered around primary prevention of lead hazards from both housing, the built environment, as well as other non-housing items to create lead-safe environments for children. The strategic plan has taken a proactive approach as we understand the importance of reducing all potential sources of lead exposure for children, and have incorporated actions to support interventions which prevent lead exposure by collaboration with other local and state agencies. This week, the Childhood Lead Poisoning Prevention Branch theme is Protect Your Family from All Sources of Lead Air Pollution, including aircraft, shooting ranges, and other sources. By focusing on lead air pollution, we're able to both consider the history of lead exposure as well as current source of lead exposure. I will particularly focus on Objective 1, how to proactively identify and equitably eliminate the largest current source of lead air pollution in California. Next slide, please. It's important at this point to provide a little bit of history about what those sources of lead air emissions are. The type and quantity of air sources of lead exposure have declined substantially in the last 30 years or so. The National Emissions Inventory overseen by the U.S. Environmental Protection Agency breaks the sources down into 5 categories. Number 1, fuel combustion, which includes emissions from coal, gas, and oil-fired power plants and industrial, commercial, and institutional sources, as well as residential heaters and boilers. Number 2, other sources, which includes chemical production and petroleum refining. Number 3, on-road vehicles, which includes cars, trucks, and motorcycles. Number 4, non-road engines, for example, piston engine aircraft engines, as well as other non-road sources typically inventoried, such as farm and construction equipment, lawnmowers, chainsaws, boats, ships, snowmobiles. And number 5, metals industrial processing, such as lead smelters and recyclers. You'll notice that on the left-hand side of the graph, in 1990, the red category of metal industrial processing was the primary source of lead emissions. But by 2014, metal industrial processing related to smelters and recyclers, as well as fuel combustion and the other sources category, had all decreased by 90% in comparison to 15 years prior. Meanwhile, non-road engines, due to the use of leaded aviation gas, remain the largest source of lead emissions to air. The history behind the use of leaded avgas goes back to the 1930s. Next slide. Historically, as illustrated by this chart, showing the use of lead in paint and gasoline over time, lead in paint and lead in motor fuel have been, by far, the greatest industrial sources of lead released into the U.S. environment. For Goal 3, lead-safe environments, the Childhood Lead Poisoning Prevention Branch and other local health jurisdictions we partner with have long been active in identifying eliminating lead hazards from paint, both in homes and in non-housing sources of lead, such as toys and pottery. That is reflected in our current scope of work, that requires not only continued investigations for such sources as part of case management in response after a child is poisoned, but now also require proactive primary prevention. Such proactive inspections of housing and non-housing sources of lead exposure enables identification and removal of lead hazards from paint before a child is poisoned. Our branch has also sought and received funding from the U.S. Department of Housing and Urban Development that, with our partners in Orange County and Ventura County, is enabling the removal from lead-based paint hazards in homes before a child is exposed. For air emissions from motor fuel, the task is a bit trickier. Such emissions, in tandem with fine dust from lead-based paint, have contaminated soils that are seasonally resuspended in the atmosphere. Lead-contaminated soil standards that the U.S. Environmental Protection Agency is likely to review in the next few years may be able to address that issue. In the interim, the Childhood Lead Poisoning Prevention Branch is focusing on the largest current source of lead emissions from motor fuel, the leaded aviation gas used in small piston engine aircrafts used, for example, to train pilots, in crop dusters, and in most of the planes owned by private pilots. Leaded aviation gas, or avgas, has historically been a significant source of lead emissions. A good example is on this chart. When you look at the blue line of gasoline use between 1940 and 1950, a sharp spike exists in the middle. That is largely due to the jump in military use of leaded avgas from 1943 to 1945 during World War II. Next slide. The largest current source of air emissions in California is from the leaded aviation gas that fuels small piston engine aircraft. Such planes release 50 tons of lead into the air in California each year. That is more than in any other state. Alone, those leaded avgas emissions are responsible for more than 70% of all lead emissions to air in California. Leaded avgas is currently sold at more than 400 general aviation airports across the state. More than 100 of those airports are located in disadvantaged communities where other environmental hazards exist that increase the impact of lead exposure on children. 2 weeks ago, the U.S. Environmental Protection Agency announced the selection of the Childhood Lead Poisoning Prevention Branch as the recipient of a 2-year, $780,000 grant to support the transition from leaded avgas. During the project period, we will develop a training and as well as educational materials, conduct community roundtables, and develop case studies to support that effort. The goal will be to support during the 2-year period the transition from leaded avgas from a handful to 30 general aviation airports located in disadvantaged communities across the state. That effort will be helped by the U.S. Environmental Protection Agency announcement last week, issuing a Clean Air Act endangerment finding that found leaded avgas emissions are a threat to public health and welfare. Together with the Federal Aviation Administration, they'll be working to identify safer fuels to replace leaded avgas. Taken together, these efforts are a major step for primary prevention to lead air emissions in California. Next slide, please. Before ending, I want to extend an invitation to you. As the Childhood Lead Poisoning Prevention Branch moves forward on primary prevention, we are also reviewing, for the first time since 2008, our lead-related construction regulations under Title 17 of the California Code of Regulations. Though we have made critical changes to the regulations since 2008, this will be the first comprehensive review in 15 years. The goal of the effort is twofold. First, we will be considering whether to amend, strike, or add to the existing Title 17 regulations. Second, Senate Bill 1076 was signed into law by Governor Newsom last year. It requires the Childhood Lead Poisoning Prevention Branch to seek authorization from the U.S. Environmental Protection Agency to implement the lead-based paint renovation, repair, and painting rule, also known as the RRP rule. To do so, renovation regulations will need to be added to the Title 17 lead-related construction regulations. We are seeking your input on the 2 questions posed on this slide. If you have thoughts about either of those activities, please provide a written response via email by November 17th. Additional information about this activity and how to submit your input is on the slide, as well as the Childhood Lead Poisoning Prevention Branch website. Next slide, please. Finally, I want to reiterate Jessica's initial message. Earth Justice tomorrow will be presenting on the role of environmental and community groups in bringing change at the federal level, EPA's proposed endangerment finding for leaded avgas, and what it means for the future of leaded aviation gas. On Thursday, San Diego Pediatricians for Clean Air will discuss policy change in reducing leaded aviation gas, how it supports community health, and the importance of advocacy work. And then on Friday, Santa Clara County CLIP and the Childhood Lead Poisoning Prevention Branch will present on state and local efforts to educate communities about the impacts of leaded aviation gas and ways to protect families' health. If you haven't already done so, I encourage you to register for these events. I think they're going to be excellent. So with that said, thank you for your time. And if you have any questions, this is a great time to ask them.